Hey guys, welcome back to the Medicare Masterclass. This is lesson 3 of the course where we talk more about the Medicare Advantage Plan specifics. In the last lesson, we talked about supplemental coverage and the types of options that are available to you in addition to original Medicare. But in this plan, we're going more in depth with the Medicare Advantage plans, mainly because they are more regulated, they have more rules involved, and they're probably the most difficult to understand out of all of them. So we thought it merited its own lesson. So agenda today, we're going to talk about the different plan structures of Medicare Advantage plans, the plan types, the networks that you work with, what it takes to qualify for them, why they have a star rating, and then 10 important things to know about Medicare Advantage plans. So getting started, and just a slight review, Medicare Advantage plans are where your Medicare is managed and administered through a private insurance company. They combine your Parts A and B and usually include Part D and combine it all into one plan, call it Part C. You can think of as complete because it's the all-in-one package, right? And first and foremost, MAPD, which stands for Medicare Advantage Prescription Drug with Prescription Drug Coverage. This is the most common setup of Advantage plans, and it's basically like a standard insurance policy you may be used to most of your life. So it does have the drug coverage built into it. It covers your hospital, medical, drugs, gives you the extra benefits as well, all in one nice, convenient plan. The next one is called an MA only plan, or Medicare Advantage only. It means that it does not have the prescription drug coverage built into it. And this is usually designed for those people who have creditable coverage elsewhere. Creditable coverage meaning it's coverage that meets Medicare standards. So if you're not going to be on Medicare when you're eligible, they want you on something creditable. So a good example of this is someone who qualifies for VA benefits through their local VA hospital. And just with how it's set up there and how they treat patients, their drug coverage is considered creditable by Medicare, but their medical is not. So I recommend all my veterans who are my clients sign up for Part B to give you a second opinion and protection against a late enrollment penalty outside of the VA. And since you don't need drug coverage, since it's through the VA, although you're more than welcome to have it if you like, it's a plan that does not have the drug coverage, which is actually the most expensive aspect of a plan. And so these MA-only plans are pretty good. They give you great benefits, low copays, and you don't have to worry about prescription drugs. They're also designed for those people who maybe didn't sign up for Part D when they should have, and a few years have gone by, and who are going to get a nasty penalty if they choose to sign up with something with Part D. So it makes sure that they don't have to have that penalty and still get the great benefits of a Medicare Advantage plan. Now, the last one is what's called a special needs plan. These are designed for people who are in certain living conditions and situations. And there's 3 types of special needs plans. We call them SNPs for short because Medicare's full of acronyms. The first one is a DSNP, or a dual special needs plan. These are plans designed specifically for people who qualify for both Medicare and full Medicaid benefits. Basically combines the benefits into one plan and makes it really easy and convenient for that vulnerable population. The next one is a CSNP, or a chronic special needs plan. These plans are designed for people with certain chronic conditions, such as diabetes, Lou Gehrig's disease, end-stage renal disease. Depends on what the plan's chronic condition is that it's been built for. Excuse me, and the ISNP plan, or an institutional special needs plan, designed for those people living in assisted living facilities or long-term care. Now, all of these plans may or may not even be available to you in your state. Again, they are based on what county you live in because of the networks that are involved. So we can check for you if you'd like if there's a special needs plan for your situation, but just know they're not always available, just depending on where you live. Now, talking about plan types and networks. So, again, because your Medicare is managed through a private insurance company, you do need to use their contracted networks of providers and hospitals. And network structures will vary between plans and with companies as well. So the first one and most common is the PPO plan, Preferred Provider Organization. Says you have a network, you stay in that network, the plan will cover it. You go out of the network, the plan may still cover it, you're just going to have a higher copay. So there's no referrals on PPO plans, and it gives you a lot of flexibility to see who you need to. Plus, with all Advantage plans, worldwide emergency coverage. So you can go to an urgent care or an emergency room and know that you will be covered in an emergency. The out-of-network for a PPO is more or less for non-emergency coverage, or maybe there's a doctor out of state you really, really want to go see and don't mind paying the extra cost sharing. The next one is an HMO, or a Health Maintenance Organization Plan. Similar to the PPO, has a network, but you got to stay in that network. If you go out of the network and it's not in an emergency room or urgent care, you're going to pay the full cost of it. Now, HMO plans traditionally require referrals to see a specialist or get more major procedures. Most plans have gone away from the referrals for specialists, but they are still there, or they're being handled in the background where you don't really have to worry about them. But just know that they're not as restrictive as they traditionally have been as well. And because they only have the network to deal with, they don't have out-of-network coverage to worry about, they tend to be cheaper in copays and premiums as well than the PPO plan. Now, the next one is an HMO POS plan, which does not stand for piece of, naughty word, it stands for point of service. And this is basically a hybrid plan between an HMO and a PPO. It kind of bridges the gap between them. It has all the same general rules that apply to an HMO plan, but you can receive certain services, that's the point of service option, out of network. Certain services, not everything though. So it's kind of a hybrid plan between, like I said, the HMO and the PPO plan. Now we're getting on to some more rare plan structures. You don't see these often. You may never see them, but they are out there and it's for your understanding. This one is called a PFFS, or Private Fee-for-Service Advantage Plan. Basically, you can see any doctor that accepts original Medicare. The plan will determine how much it'll pay the providers, and providers can choose to accept those the plan's payment terms or not. So you can see everyone who accepts original Medicare, but the doctor doesn't necessarily have to accept the plan and see you. So just know that. It's like a Medigap Plan's flexibility, because you can see anyone who accepts original Medicare, but the doctor can say no in this situation. And also another more rare option is the Medicare Cost Plan. It does have a network of providers, and will have your copays and stuff assigned to those. But you can see any doctor in the United States that accepts original Medicare at original Medicare cost sharing. And this is the one plan where you actually can have a standalone prescription drug plan along with this Medicare Advantage plan. Normally, it's either one or the other. You cannot have an Advantage plan and a prescription drug plan on the side. In this case, you can, and it's if the plan does or does not have drug coverage. Also more rare, but just so it's on your radar. Now, eligibility. Not too long ago, the only health question that Advantage plans asked was, do you have end-stage renal disease or stage 4 kidney failure? If you did, you could not make a plan change. But that has since gone away, and the only eligibility questions or rules of eligibility are you must be enrolled in Medicare Part A and B. That is also true for a Medicare supplement or Medigap plan. And you must live in the plan's service area. Medigap plans still have this rule, but Medigap plans, as long as you're in the state, somewhere in the state, you qualify, or you're eligible to have a Medigap plan pending you pass underwriting or have a guaranteed issue right. With Advantage plans, because they do have networks, they are based on what county you live in. Because the plan may not have contracts with the providers in the county you live in, they may or may not always be available to you. So that's why all the commercials ask for your zip code to see if you qualify for extra benefits. They're just saying if there's any plans available in your area. Now, CMS, or the Centers for Medicare and Medicaid Services, use a 5-star rating system to measure how well Advantage plans and prescription drug plans perform in a variety of categories. You can see all those categories and look them up, but they give one general star rating to basically encompass them all. Now, they help consumers to compare plans based on quality and performance. And the way I've been told, and I kind of like this analogy, is there's really only 3-star ratings. There's 1 to 2 stars, which is a poor performing plan, and more often than not, they are pulled from the market. I don't see too many of those at all for that reason. Then there is 3 to 4.5 stars, which is where probably 90% of all plans fall into. Not a real statistic, just a rough guess. But and these are great performing plans. You may see 3 stars and think, it's average. But really, it is a hard rating to achieve. And it's a great plan regardless, especially if it's working well for your prescriptions and your doctors. So most of your plans are going to fall within this range. Do not feel bad if the plan that works best for you is 3 stars. It's still going to take good care of you. And last but not least, that golden 5-star rating. This is extremely hard for a company to achieve. There's a small percentage of them throughout the country for that reason. So if you don't have a 5-star plan, don't worry. It may still seem like you're getting 5-star service on it, but the 5-star rating is rare and extremely hard for a company to achieve. So you know that it's a pretty good plan and will also take good care of you as well. Now, the last things to know about Medicare Advantage plans is these 10 things. Now, I have taken these from United Healthcare's Medicare Advantage Clarity Guide. I personally use that guide for all my Medicare 101s because it lays it out so simply. So these things are, I attribute to that guide and from United Healthcare for that reason. It just works with whatever situation. So the first thing is you must continue to pay your Part B premium. The only way you get out of that is if Medicaid or a Medicare savings program is paying that for you. This is true for Medigap plans as well. Number 2, Medicare Advantage has you covered. So these plans have to at least meet the minimum standards that original Medicare covers. It'll never be worse, and if Medicare covers it, the Advantage plans do as well. They can also go above and beyond those benefits. So just know you're not going to be shorted benefits just because your Medicare is managed through a private company. Number 3, joining a Medicare Advantage plan may affect your current coverage. This doesn't apply to everyone, but it's not an uncommon issue as well. Basically, if you plan to have other coverage outside of Medicare when you enroll in a Medicare Advantage plan, it may affect how it works, especially if you are a veteran who has TRICARE for life. You really want to be careful, and as it can mess up your drug coverage if you get Part D involved. If you choose to have employer coverage, it can mess up the drug coverage and coordination. So just know, it's not an uncommon thing, but most people, usually when they move to Medicare, make the switch to Medicare. But it can affect your current coverage if you decide to have multiple coverages when you make that transition. Number 4, it's best to use network providers. Kind of a given, as these plans do have networks, you're going to get the best cost sharing by seeing someone in their network. So, kind of a gimme there. Number 5, you may qualify for financial assistance. Now, when you think financial assistance, you may think Medicaid, and that is true. That does come into play here. But there are actually a variety of different ways to get financial assistance for your Medicare. There's Medicaid, which is kind of the top tier, one that's administered through your state. Then there's Medicare savings programs, which are administered by Medicaid, even though they're not Medicaid benefits. And they, at the bare minimum, will pay that Part B premium for you. Then there's the Extra Help Program, which is a program through Social Security that helps pay for prescriptions. And there are some pharmaceutical assistance programs by your state. I don't come across them too often, and usually they're for very specific situations, but they are out there. And of course, there's tons of other things out there, like you may qualify through drug manufacturers for things, grants. There's lots of ways to get financial assistance. If this ever becomes a concern, please let me know. We can look into some more options for you. Number 6, if you enroll in Part A, B, and or Part D late, you may pay a penalty. Basically, this is saying when you are first eligible for Medicare, Medicare wants you on Medicare. If you're not, they want you on something creditable, which again is coverage that meets their standards. If you go for a period of time when you could have had creditable coverage and you did not, to when you actually get it, that gap accrues a late enrollment penalty, which unfortunately sticks with you for the rest of your life. You hear about the Part D late enrollment penalty a lot, but there's actually a penalty on A, B, and D. Little known fact. So the most common penalty that I come across is with Part D, and it's usually like someone decides that they don't need Part D coverage because they don't want to pay for prescriptions or they don't have any. More power to them if they want to do that. 10 years down the road, their health declines, they need drug coverage to cover their prescriptions. So they do, and that 10 years accrued a nice fat penalty that's tacked onto their monthly premium. sticks with them for the rest of their life. And so the longer you go, the bigger it gets. So always, always, always get Part D or some form of creditable coverage. It'll save you a lot of heartache later, and headache for that matter. Number 7, a Medicare supplement plan is not a Medicare Advantage plan. So a Medicare supplement plan's purpose is to fill in the gaps that original Medicare doesn't cover. Basically pick up some or all of that 20%. So original Medicare pays first, Medigap pays second. It's like having two different insurances that coordinate. The Medicare Advantage Plan is where your Medicare is managed and administered through a private insurance company. It combines A, B, and D, usually D, into one plan, and it's administered by the insurance company. So just know that there is a difference. Number 8, I laugh at this one. Keep your member ID card handy. If you want your insurance to cover things, you kind of need to have it with you when you're getting them done. Go figure. So even if they have it on file, it's always a good idea to keep it on hand. So keep it handy. Medicare Advantage offers the same protections as original Medicare. So even though Medicare Advantage plans are privately administered, you still have the same protections that original Medicare does. So it's not going to change. You just get Medicare standards and even then some being on an Advantage plan. And last but not least, you have a built-in financial safety net. This is called your maximum out-of-pocket. And it says that if you have your worst year ever, knock on wood, we hope that doesn't happen, but if it does, this is the most you are going to pay in a year's time, and the insurance company will take care of the rest for the rest of the year. So it's very rare someone hits it just because the copays are so good. But just know that you can budget for a catastrophic situation and know how much you're going to pay. And it's pretty cheap. For us who aren't on Medicare, we're jealous. We'll just put it at that. It does vary from plan to plan, but Medicare does set a capped amount of the plan can't have a higher maximum than that. So this concludes lesson 3 of the Medicare Advantage Plan specifics. Again, it had a lot more rules involved than the Medigap, so it merited its own lesson. So hopefully it was helpful to you. If you have any questions, please reach out to us. We'd love to clarify them for you. So in the next lesson, we're going to dive deeper into Part D prescription drug coverage and how that works, because that's a beast all on its own. We'll talk more about the donut hole if you've ever heard of that. And so thanks for watching this video. Look forward to seeing you in the next one.